Assalamu alaikum wa rahmatullahi wa barakatuh. Ashhadu an la ilaha illallah wahdahu la sharika lahu wa ashhadu anna Muhammadan abduhu wa rasuluh. Amma ba'du fa'auzu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Jazakallah for the kind introduction, and it's an honor to be among friends and other Ahmadi physicians to be here for the MSLM 2026. One correction, Sir Sahib, in the introduction, when I started the Waqf-e-Arzi, the more regular Waqf-e-Arzi in almost 5 years ago on a monthly basis, I gave up my chief of cardiac surgery position at my institution, so I just serve as the co-director of the structural heart program at my institution. I also want to take a few seconds or a minute to thank Dr. Mirza Nair Sahib. I know his presentation was very humbling and very direct, straightforward. He gave the information, but at least to me personally, he's been a great help in taking care of our cardiac surgery patients. Some of these patients are very high risk. In fact, in Rabwa, we do not get the low risk patients, the more straightforward cardiac surgery patients, because they end up going to bigger centers. So we end up getting some of the higher risk or patients or the patients who are rejected from other institutions. And after we operate on them, we leave after usually 10 days or 12 days of our visit there. And some of these patients were very sick. Dr. Mirza Nair Sahib really helps us take care of these patients after we're gone. He stays in touch with us. You talk about courage, like he said, you should not be afraid. I'm really glad he's not afraid. There was a very sick patient who got into really bad trouble recently, and even though this is not his specialty, he's not trained in thoracic surgery, but he has experience in thoracic surgery. From his general surgery training, he was not hesitant to take that patient to the operating room and take care of the problem that was there. So I'm very thankful to him for doing that. It is really an uphill battle. In some ways, it is like climbing one of the higher mountains where oxygen level is low, if you talk about practicing as a physician, because the resources is not there. The oxygen is limited in these areas in terms of, metaphorically speaking, in terms of medical practice. You don't have trained nurses. You do not have credentialed people who are doing work for you. They've taken these people from the local community and trained them themselves. So Jazakallah, Dr. Nair, for all your efforts. For my presentation, I've tried to keep it very simple. We've been hearing about Waqf and Waqf-e-Arzi for many years. Hazur has been talking about it for many years. And I feel that it's time that we start acting about it. And it's not that we're not acting on it. I think we need to increase our efforts and really make it part of our daily lives and our daily routine. So for those of you who may not understand what Waqf-e-Arzi is, it is basically provisional dedication. It's a program where members of the Ahmadiyya Muslim community offer their time and skills for a defined period to serve the Jamaat. It is temporary in some ways, but it could be, if it's done on a regular basis, it's not temporary, it's more permanent. It's obviously voluntary, and it can have far-reaching global impacts. In the interest of time, I'll just go through the slide because Dr. Nair mentioned a few things, and Dr. Qamar also talked about what Waqf-e-Arzi is. There's a hadith of Holy Prophet that says that the best of people is he who is most beneficial to others. So this is one of the ways to be beneficial to people and get blessings of Allah. The purpose of any Jamaat event, whether it's Waqf-e-Arzi, whether it's the Jalsa we attend, the prayers we do at home or in congregation, the MSLM 2026 is very simple. At the end of the day, we need to feel or have felt that we made some effort in getting closer to Allah the Almighty, His Prophet, Holy Prophet Sallallahu Alaihi Wasallam, His Messiah, and then His Khalifa of the time. And if these activities do not serve that for us, then we've wasted our time. So for the person who's doing the Waqf, obviously these benefits are there, and obviously spiritually speaking, as you are serving others, you also feel good within yourself that you're doing something, and that's human nature, that you want to do more following that. If I looked at the literature otherwise, that what do the worldly people say, people who supposedly do not believe in God, and there are scientific literature from Harvard Medical School, from Mayo Clinic, they've written articles about how humanitarian work can help you in terms of your clinical skills, your mental skills, your mental toughness. It gives you a sense of community, networking, and improves your physical health. So it's beneficial on many different levels. Dr. Nair mentioned about Fazl Umar Hospital, briefly about Tahir Hart, that the fourth Khalifa in 1980 expressed this desire that there should be a heart hospital in Rabwa. And subsequent to that, when Khalifa Masih al-Khamis became Khalifa, he started active work on it. In fact, he had started to work on it prior to him becoming a Khalifa when he was Nazir Ala. But subsequently, the foundation stone was laid, and in 2003, by two of our Jamaat's Buzurgs. Both of them I met personally, very dear to me, Chaudhry Hamidullah Sahab and Mirza Khurshid Sahab. And it was a blessing of these trips that I was able to interact with them and then learn from them on several occasions, one-on-one. And in 2007, September 15, 2007, is when the hospital was inaugurated and the cath lab started, and a year after that, cardiac surgery started as well. At Tahir Hart, and then you saw the recent figures from last year that Dr. Nair presented, 185 heart surgeries. That includes congenital heart surgeries as well as adult heart surgeries, and inshallah our team is growing. There are increased number of surgeons who are interested. Our main struggle in the beginning was lack of anesthesia support and lack of intensive care support, and we're working hard, and I think that situation is improving with time. I request prayers for that. I will share some sayings of Hazrat Khalifatul Masih V. On 17th October 2003, Huzur said in his Friday sermon that on Jalsa, I brought the attention of our doctors towards doing either temporary waqf-e arzi or working permanently in our hospitals in Africa. Now with the grace of God, the situation is much better. That means that there are some physicians there. The problems and difficulties faced by the original Waqfeen are no longer present, and Huzur mentioned some of these Waqfeen in our recent group mulaqat in UK as well. In the most places, the situation is much better and every facility is present. Even if a few difficulties are present, then keep your oath in front of you. That means that it's easier to practice medicine. It was much more difficult prior to that. And like Dr. Nair mentioned that things are improving, but obviously it takes a lot of work for these things to get better. So the Huzur is saying don't get discouraged from that. Even if a few difficulties are present, then keep your oath in front of you, which is that just for the sake of Allah, you will use your God-given powers to help humanity. Come forward and fulfill this oath that you have made with the Messiah alayhi salam of the time, and make yourself the subject of his prayers. So this is Huzur directly talking to all of us. And I think it's highly important. We say this word commonly, that's saying labbaik to the words of Khalifatul Masih, and as physicians, I think we need to start realizing that Huzur has been talking to us for several years now, and we need to start taking action in that respect. Then again, In the annual 2018 annual address to MMA UK, Huzur said, Ahmadi doctors from here should travel to Rabwa with the exclusive intention and objective of serving in our hospital. When Huzur made these comments, I had the privilege of meeting Huzur after this address a few days afterwards, and one of my fellow physicians had said that Huzur had only asked the MMA UK to do this. So I asked this to Huzur. I said, Huzur, some people are saying that you've only requested MMA UK. And Huzur said, nahi, ye sab ke liye tha. So Huzur was speaking to all of us. Huzur says, MD doctors from here should travel to Rabwa with the exclusive intention and objective of serving in our hospital. Indeed, it should not be as I have seen, that you go to the Pakistan to see your families, and during those family visits, you spare 1 or 2 days to work in the hospitals as Waqf-e-Arzi. So again, I would say this is not enough. Your sole purpose should be to serve in the Jamaat hospitals in order to gain the pleasure of Almighty Allah. I will skip the last slide. I think I've made my point. But I would request everybody to go listen to the MMA UK address of Huzur Anwar from 2018 and 2019, and then the MMA International address from 2024, in October 2024. Please listen to that. They're all available on YouTube. This is a one of my favorite couplets of Hazrat Aqdas Masih Maud al-Islam. It's a Persian couplet. Huzur says, Mera maqsoodo matlubo tamannao khidmat khalqast, hami karam, hami baram, hami rasmam, hami raham. That my desire, my wish, and my objective is serving humanity. It is my job, my faith, and my inspiration and my way. So, my friends, I request that we need to answer the call to serve. We can see the world systematically unraveling in front of us. These are the latter days. If anybody has any doubt, just look around yourself. These are the latter days. And Huzur Anwar is showing us a way to save ourselves, our families, and we need to take heed from those guidance and instructions and do this. By the way, Waqf-e-Arzi does not happen in a vacuum. Your families are involved with that. So the first thing you do is go talk to your spouse, and then write a letter to Huzur for prayers, and then start the process. Jazakumullah.